Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a hematologist talking to a patient called Mr. Allen. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Allen. It's nice to meet you. I understand you were referred to me after some recent test results came back. How are you feeling today?
Well, to be honest, I'm a bit nervous. I've been tired for months, and when my GP called to say they found something unusual in my blood tests, I got worried. They mentioned something called myelofibrosis, and I've been looking it up online ever since, but I'm not sure I understand it all.
I understand how overwhelming it can feel when you hear unfamiliar terms like that. Let me explain it clearly for you. Myelofibrosis is a type of chronic blood cancer. It affects the bone marrow, the tissue inside your bones that produces blood cells. Over time, scar tissue forms in the marrow, which makes it harder for your body to produce enough healthy blood cells. This can lead to a variety of symptoms, including fatigue, anemia, and sometimes an enlarged spleen.
So, it's cancer? I wasn't expecting that. I knew something was off, but I didn't think it was that serious.
Yes, it is classified as a type of blood cancer, but it's important to know that it usually progresses slowly, and many patients live with it for years while managing the symptoms. It's different from some of the more aggressive forms of cancer, and there are treatments available to help control it.
That's a relief, I guess. But what does this mean for me? How did I get this, and what can I do?
Myelofibrosis can develop on its own, or it may be secondary, meaning it occurs as a result of another condition, like polycythemia vera or essential thrombocythemia, both of which are related to blood cell production. The exact cause of primary myelofibrosis isn't well understood, but it's linked to mutations in certain genes, particularly one called JAK2, which regulates blood cell production. It's not something you did or could have prevented.
I see. So, how do you treat it? Is there a cure?
Right now, there's no cure for myelofibrosis, except in rare cases where a bone marrow or stem cell transplant is possible. But transplants are very high risk and not suitable for everyone, especially if they have other health issues. That said, our main goal is to manage your symptoms and improve your quality of life. Treatments are designed to reduce complications like anemia, alleviate discomfort from an enlarged spleen, and slow the progression of the disease.
What kinds of treatments are available? I've read about medications, but I'm not sure what's best.
That's a great question. There are a few options we can consider depending on how your symptoms are affecting you. One common medication is a JAK inhibitor called ruxolitinib, which targets the genetic mutation I mentioned earlier. It can help reduce spleen size, improve symptoms like fatigue, and potentially slow disease progression. There are also medications to help manage anemia, such as blood transfusions or hormone treatments like erythropoietin.
And what about side effects? I'm concerned about taking medications with serious side effects.
It's always a valid concern. With ruxolitinib, for example, side effects can include dizziness, bruising, or increased risk of infections, because it can affect your immune system. We'll monitor your blood work closely and adjust the treatment as needed to minimize any complications. Every person's response is different, so it's a matter of finding the right balance for you. And if one approach isn't working or is causing too many side effects, we can explore other options.
I appreciate that. I've also read that the spleen can get really enlarged. How do you treat that?
Yes, an enlarged spleen is a common symptom in myelofibrosis. If it becomes uncomfortable or causes other problems, we can manage it with medications like ruxolitinib or, in more severe cases, radiation therapy to shrink the spleen. In some instances, if the spleen is causing significant issues that can't be controlled, a splenectomy, surgical removal of the spleen, might be considered, though that's a last resort due to the risks involved.
It sounds like there's a lot to think about. What's the next step for me?
Right now, I'd recommend doing a few more tests to assess the extent of the myelofibrosis. We'll check your blood counts regularly and might also do a bone marrow biopsy to better understand how far the condition has progressed. Based on those results, we can decide on the best course of action, whether it's starting medication or simply monitoring your condition closely for the time being.
A bone marrow biopsy? That sounds painful.
It can be uncomfortable, but we'll use a local anesthetic to numb the area, and the procedure is fairly quick. It provides us with valuable information about how much scar tissue is in your marrow and the state of your blood cell production. The results will help guide your treatment.
All right, I'll do what needs to be done. I just want to feel like myself again. The fatigue has been the worst part. Some days, I can barely get through the day.
I completely understand. Fatigue is one of the most challenging symptoms of myelofibrosis. We'll work on managing it with treatment, and we can also explore other ways to boost your energy levels, like lifestyle adjustments, nutritional support, or possibly supplements. You don't have to go through this alone. We'll be monitoring your condition closely and adjusting your care plan as needed.
Extract 2, questions 13 to 24. You hear Dr. Hughes talking to a patient called John Reynolds. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. Good afternoon, Mr. Reynolds. I understand you've been having some trouble with nightmares lately. Could you tell me a little more about that?
Yes, doctor. It's been going on for a few months now, maybe longer. I keep having these really vivid, terrifying dreams. They wake me up almost every night, and I can't get back to sleep afterward.
I see. Do you remember the content of these nightmares? Are they similar each time, or do they vary?
They're mostly the same, I think. I'm usually being chased, sometimes by someone or something I can't see. There's this overwhelming sense of fear, like something terrible is going to happen. Sometimes I'm trapped, and no matter what I do, I can't get out. I wake up sweating, heart racing, you know? It's exhausting.
That sounds incredibly distressing. Have you noticed whether anything specific triggers these nightmares? Stress at work or home, for example?
Well, I've been under more stress at work lately, but I can't say for sure that it's what's causing the nightmares. They seem to come randomly. Some nights are worse than others.
And how frequently are you experiencing them?
Almost every night now. Maybe 5 or 6 nights a week. It's gotten to the point where I'm scared to go to sleep. I'll try to stay up as long as I can, but eventually I crash and the nightmares come anyway.
That's quite a high frequency. When you wake up from these nightmares, do you have any difficulty distinguishing between the dream and reality?
Yeah, sometimes. I'll wake up, and for a few seconds, I'm still in it. It takes me a minute to realize I'm safe in bed, and even then, I feel like something's still lurking. It takes me hours to calm down enough to even think about falling back asleep.
Do you ever experience sleep paralysis when you wake up?
No, I don't think so. It's more that I'm just rattled, Like, even though I can move, I feel trapped in the fear, if that makes sense.
It does. Have you tried any techniques to manage or reduce the nightmares, like relaxation exercises or changing your sleep environment?
I've tried some deep breathing exercises before bed, and I've cut back on caffeine, thinking that might help, but nothing seems to make much of a difference. I've even tried sleeping with the TV on for background noise, but that didn't help either.
Have you noticed any other changes in your sleep habits, aside from the nightmares? Like trouble falling asleep, waking up often for other reasons, or feeling unrested in the morning?
I used to sleep pretty well, but now I feel like I'm always on edge. It takes me longer to fall asleep, and when I do, it's not restful. I wake up feeling just as tired as when I went to bed.
It sounds like these nightmares are severely affecting your sleep quality, which can in turn impact your overall health and well-being. Do you find that these nightmares are affecting your daily life? For example, are you having trouble concentrating at work or feeling more irritable?
Yeah, definitely. I'm tired all the time, and it's hard to focus. My mood's been all over the place too. Little things that wouldn't normally bother me make me snap, and I just feel on edge all the time. My partner's noticed it too.
I imagine it's been difficult to manage. Let's talk a bit more about your mental health. Have you experienced any symptoms of anxiety or depression recently?
I've been more anxious, for sure. I think it's mostly because of the lack of sleep, but yeah, it's getting harder to deal with things. I'm not sure if I'd say I'm depressed, but I've definitely felt down more often lately.
Given the frequency and intensity of your nightmares, as well as the impact they're having on your mood and daily functioning, I believe you may be experiencing what we call nightmare disorder. It's a condition where recurrent nightmares significantly disrupt sleep and can lead to problems during the day, like fatigue, irritability, and difficulty concentrating.
So, it's an actual disorder. I thought I was just having bad dreams.
Yes, it's a recognized sleep disorder. While everyone experiences bad dreams occasionally, nightmare disorder refers to when these nightmares occur so frequently and are so distressing that they affect your well-being and quality of life, which seems to be the case here.
Wow, I didn't realize it was that serious.
It can be, but the good news is there are treatments that can help. One approach is cognitive behavioral therapy for insomnia (CBTI), which includes techniques for managing anxiety around sleep and addressing the nightmares themselves. There's also a method called image rehearsal therapy, where we work together to change the content of your nightmares while you're awake, to make them less distressing when they occur. That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear 2 neurologists discussing a patient's recent symptoms related to Alice in Wonderland syndrome.
I've just reviewed the latest report on Mr. John's condition. He's still experiencing significant size distortions. Did you see the update?
Yes, I did. His latest episode occurred during a regular checkup, and he reported feeling as though his hands and feet were much larger than normal. The sensations only lasted a few minutes, but it's troubling that they're becoming more frequent. We should probably run a new set of neurological tests soon, just to rule out any other underlying issues. He's finding it quite unsettling and confusing, so it might be hard to get him to cooperate.
Right. I'll make sure we schedule it soon. Let's hope he's more comfortable with it this time.
Now look at question 26. You hear a medical professional explaining about Laura. Now read the question.
frequent respiratory infections during this period. Upon examination, I noticed the classic signs of yellow nail syndrome, where the nails have a distinct yellow discoloration, are thickened, and growing unusually slowly. Given the association of this condition with both respiratory and lymphatic issues, I emphasized the importance of addressing her underlying health problems. We discussed treatment options, and while topical antifungal treatments can sometimes help with the appearance of the nails, I recommended focusing on managing her respiratory symptoms first. Laura agreed to start a course of treatment targeting her lung condition, along with the antifungal cream to help the nail issues. After about 8 weeks, her respiratory symptoms improved, and there was a noticeable change in the thickness and color of her nails.
Now look at question 27. You hear two nurses discussing a peer review after completing a ward task. Now read the question.
How do you think your peer review went after your handover today?
I think I did well on the handover itself, but I could have asked for more input from the rest of the team when discussing the patient's discharge plan.
Yes, that's true. Encouraging more team involvement would have been helpful, but overall, you communicated the patient's condition and next steps clearly, which is important.
Thank you.
You also made sure all the necessary details were documented before the meeting. You checked in with the other nurses about the patient's progress, noted key updates, and shared your findings accurately. You kept everything professional and concise.
Yes, I tried to stay on top of the documentation.
You did well. One thing to improve would be engaging the team more during discussions. It helps ensure a collaborative approach and holds everyone accountable.
I'll definitely work on that next time. Thanks for the feedback. Now look at question 28. You hear a family member talking to a psychiatrist. Now read the question.
Doctor, I'm worried about my brother. Ever since he returned from a trip to Jerusalem, he's been acting very strangely. He started wearing a white robe, cleaning the house obsessively, and he even tried to preach to our neighbors. I don't know what's going on.
That sounds concerning. What you're describing aligns with a condition known as Jerusalem syndrome. It's not uncommon for people who visit the Holy Land to experience religious delusions or obsessive behavior, even if they have no prior mental health issues.
I see. Does that mean this is permanent?
Not necessarily. Most cases are temporary. While your brother may be experiencing intense symptoms right now, the syndrome typically resolves on its own within a week or so. However, we'll continue to monitor him closely in case further intervention is needed.
So, it's possible he'll return to his normal self soon?
Yes, that's very likely. But if the symptoms persist beyond a week, we may need to explore further treatment options.
Now look at question 29. You hear an intern talking about a patient. Now read the question.
Yes, of course. Here we have a 32-year-old man with no prior neurological history presenting with exaggerated startle responses. According to his partner, he seems to overreact to sudden stimuli. For instance, he may jump, scream, or even imitate commands involuntarily when surprised. This has been going on for several months, and there's no obvious explanation like trauma or substance use. The patient himself mentions that his co-workers find his reactions amusing, but he feels embarrassed and unable to control them. On physical exam, his neurological findings are within normal limits. Here, we have a video recording of one of his episodes that was captured by his partner.
So, what is the specific diagnosis?
Based on the patient's exaggerated responses and historical information, he presents with jumping Frenchman of Maine syndrome, a rare startle disorder likely influenced by cultural or genetic factors. Although the exact cause is still unknown, it fits the classic presentation.
Are any further tests or interventions required for management? What is your next step?
In general, further neurological testing like imaging isn't required as there are no physical abnormalities. The next step would be symptomatic management, focusing on behavior therapy or lifestyle modifications to minimize triggers.
Now look at question 30. You hear a trainer talking about communication skills. Now read the question.
We're going to talk about competences that will be crucial for you as future dentists. We've already covered the foundational clinical skills like cavity fillings and root canal procedures. Today, we're building on that by focusing on the non-clinical competences that will set you apart in the ever-evolving healthcare landscape. For instance, you'll need strong communication skills. You've learned the technical aspects, but explaining a complex procedure like a root canal to an anxious patient is a different challenge. You'll also need business acumen because managing a dental practice requires more than just knowing how to treat teeth. You need to handle finances, manage staff, and ensure the practice runs smoothly. Lastly, don't underestimate the power of empathy. Patients aren't just sets of teeth, they come with emotions, anxieties, and concerns, and addressing those will build trust and loyalty. We're not focusing on the clinical techniques today, but these additional competences will be key to your success.
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a presentation by a consultant neurologist called Dr. Jennifer Hall, who's talking about amyotrophic lateral sclerosis. You now have 90 seconds to read questions.
Hello, I'm Dr. Jennifer Hall, consultant neurologist at this hospital. Today, I'm talking about amyotrophic lateral sclerosis, or ALS, also known as Lou Gehrig's disease. This is a progressive neurodegenerative disorder that affects motor neurons in the brain and spinal cord, leading to muscle weakness, impaired coordination, and eventually paralysis. I will describe the symptoms. the progression of the disease, and the implications of recent research findings for healthcare professionals and patients alike. ALS primarily affects adults between the ages of 40 and 70. Initial symptoms often involve muscle twitching, weakness in an arm or leg, or slurred speech. The disease progresses relentlessly, leading to widespread paralysis and ultimately an inability to breathe without support. It's important to note that the course of ALS can vary considerably among patients. While the majority survive for around 3 to 5 years after symptom onset, some live longer, and about 10% survive for more than 10 years. The precise cause of ALS remains largely unknown, though approximately 10% of cases are familial ALS caused by a genetic mutation. The other 90% are sporadic, meaning they occur without an evident genetic link. Current research points towards a combination of contributing factors, including environmental exposures, genetic susceptibility, and possibly certain lifestyle factors. A key area of recent research focuses on developing medications to decelerate the disease's progression. There are only a couple of FDA-approved drugs, riluzole and edaravone, that have shown the ability to modestly slow the progression of ALS, but they do not offer a cure. Riluzole works by reducing the release of glutamate, which is suspected to harm motor neurons, while edaravone acts as an antioxidant that may alleviate oxidative stress related to ALS. Furthermore, a relatively new drug called MX0035 has shown promise in clinical trials, presenting hope for improving both survival rates and maintaining motor function. An essential aspect of ALS care is supportive treatment. Because ALS is progressive, multidisciplinary care is fundamental. This includes a team of healthcare professionals such as neurologists, physical therapists, occupational therapists, speech therapists, respiratory therapists, and nutritionists, all collaborating to enhance the patient's quality of life. Physical therapy can help maintain muscle strength and decrease spasticity. Occupational therapy assists patients in adapting to daily activities. And speech therapy is crucial as the patient's ability to communicate verbally diminishes. Augmentative and alternative communication tools, such as eye-tracking devices, can help patients express themselves effectively, even when speech becomes significantly impaired. One crucial topic to discuss with ALS patients is respiratory assistance, as most will eventually require ventilatory support. Initially, non-invasive ventilation can be useful, but some patients may decide on more invasive interventions, like a tracheostomy, to extend their life. These conversations need to be handled with sensitivity, as they touch on quality of life and the patient's preferences for end-of-life care. Another important factor is nutrition. As swallowing becomes more challenging, ensuring adequate nutrition becomes critical. In these cases, a feeding tube might be recommended to provide necessary nutrition and prevent aspiration. Decisions surrounding feeding tubes and respiratory interventions are highly personal and should involve conversations with patients and their families, considering their values and goals. ALS also significantly affects the emotional health of both patients and their caregivers. Depression and anxiety are common, and psychological support is a vital component of care. The role of the healthcare team here is not only to provide medical assistance, but also to help patients cope with the diagnosis and the uncertainties it brings. Recent research has identified some promising avenues, including gene therapy, stem cell therapy, and the use of certain anti-inflammatory drugs. For instance, gene editing technology like CRISPR is being explored as a potential way to correct genetic mutations responsible for familial ALS. Although these approaches are still in experimental stages, they provide hope for a future where ALS could be better managed or potentially cured. In conclusion, ALS is a devastating condition that impacts every facet of a patient's life. Effective management of ALS requires providing comprehensive, compassionate, multidisciplinary care that addresses not only the physical aspects of the disease, but also the emotional, social, and existential needs of patients and their families. While there is still no cure, advances in research provide hope for more effective treatments and perhaps one day a cure.
Extract 2. Questions 37 to 42. You hear a conversation between a journalist and Dr. Bennett discussing pacemaker. Now, read the questions. You now have 90 seconds to read questions.
Hello, and welcome to today's conversation about innovations in healthcare technology. We'll be discussing a topic that has significantly advanced the management of heart rhythm disorders: smartphone-connected pacemaker devices. Joining us is Dr. Edward Bennett, a cardiologist with expertise in cardiovascular health and arrhythmia management. Welcome, Dr. Bennett.
Thank you for having me. I'm excited to talk about this groundbreaking technology.
Dr. Bennett, could you start by giving us a brief overview of what a pacemaker is and how its technology has changed over time?
Certainly. A pacemaker is a small device that's implanted in the chest to regulate irregular heart rhythms. It sends electrical impulses to ensure the heart maintains a stable beat. Pacemakers have been around for many years, but recent developments have made them much more user-friendly and efficient. Traditionally, pacemaker patients required frequent visits to their healthcare providers to adjust settings, monitor performance, or check the battery. But with the introduction of smartphone-connected pacemakers, a lot of these activities can now be done remotely, which is a huge advantage for both patients and doctors.
That's a huge leap forward. How do smartphone-connected pacemakers actually function?
These pacemakers connect wirelessly to the patient's smartphone using a secure app. Through this app, the device transmits data about the patient's heart rhythm in real time, which can be reviewed by the patient and their healthcare team. The doctor can monitor the patient's condition, adjust the pacemaker settings remotely, and receive alerts about any potential issues, such as irregular heartbeats or low battery levels. This technology drastically reduces the number of clinic visits required and enables faster response times in critical situations.
That's really impressive. How has this technology changed the way patients engage with their own care?
One of the biggest advantages is the way it empowers patients. With their heart data accessible on a smartphone, patients are more actively involved in managing their health. They can monitor their heart rate, check how well the device is functioning, and take preventative measures if necessary. This heightened awareness leads to better compliance with medical advice, and patients often feel more confident and less anxious because they have greater insight into their condition.
You mentioned earlier that the pacemaker sends out alerts. Could you elaborate on what kind of notifications these devices send and how they support the management of heart conditions?
Sure. The pacemaker can send various types of notifications. For instance, if the device detects an abnormal heart rhythm or the battery is running low, it sends an alert to the patient's smartphone, which is then forwarded to the healthcare provider. In more severe cases, such as a dangerous arrhythmia, the system may even contact emergency services directly. This type of real-time monitoring helps in catching potential issues early and allows for quick intervention before they escalate into life-threatening conditions like heart failure or a stroke.
It's remarkable how much more efficient care can be with this technology. But are there any drawbacks or challenges with using smartphone-connected pacemakers?
There are a few. First,
Not all patients are comfortable using smartphones. Older patients in particular may find it difficult to navigate the technology or may not have regular access to it. There's also the concern of data privacy. Though the communication between the pacemaker and the smartphone app is encrypted, protecting sensitive health data is a constant priority. Additionally, even though this technology reduces the number of necessary clinic visits, in-person checkups are still required from time to time to assess the patient's overall health.
Data privacy is a concern in almost every area of technology nowadays. How are manufacturers working to ensure these devices are secure?
Manufacturers are tackling this issue by employing strong encryption protocols to safeguard the data that flows between the pacemaker and the smartphone. Regular updates are also made to the app's security features to stay ahead of potential cyber threats. Healthcare providers also play a role in educating patients about how to keep their data safe, such as using strong passwords and updating their apps frequently. Regulatory bodies are closely involved as well, establishing safety and security standards that all manufacturers must follow.
Even with those challenges, would you say the benefits of smartphone-connected pacemakers outweigh the risks?
Yes, without a doubt. The ability to remotely monitor heart conditions, make adjustments, and provide real-time alerts is a significant improvement in patient care. Although data security and patient education are essential concerns, the advantages of this technology in improving patient outcomes and enhancing the quality of life are undeniable.
It sounds like we're only beginning to see the potential of this technology. What future developments do you anticipate for pacemakers?
We are definitely just scratching the surface. I foresee future pacemakers becoming even smaller, more efficient, and with a longer battery life. They may also be able to monitor other health metrics, such as blood pressure or oxygen levels. There's also potential for further integration with wearable technologies, like smartwatches, which could make it even easier for patients to track their health. I also believe artificial intelligence will play a larger role, predicting potential heart issues based on the data collected by the pacemaker.
That's really exciting. Before we conclude, do you have any advice for patients considering a smartphone-connected pacemaker?
My advice is to talk in depth with your cardiologist. Make sure you understand how the device works, what the benefits are, and how it fits into your lifestyle. It's important to weigh all the options and ensure you're comfortable with the technology. For most patients, the pros far outweigh the cons, especially considering how much this technology can improve their condition.
Thank you so much, Dr. Bennett, for sharing your insights with us today.
It was my pleasure. Thank you for having me.
That is the end of Part C. You now have 2 minutes to check your answers.